So I think endocrinology has seen a great boom. And the last in that, if I were to just flag the major things that have changed. So one, I said lifestyle disorders increased dramatically. Number two, I said technology improved things a lot for us. And the gap between India and the West reduced a lot. Another watershed moment is the discovery of these new GLP-1 molecules, which are again changing the way endocrinologists look at chronic disorders.
Today we have with us Dr. Ambrish Mithal, one of the most renowned endocrinologists. He currently serves as Group Chairman in Head Endocrinology and Diabetes at Max Healthcare, a group of 22 hospitals.
Way back in 1997, the WHO classified obesity as a disease.
97. Nobody knows.
Nobody knows that. So the thing is, why? Because the increase in lifestyle disorders in the West was already happening at that time. The understanding that obesity is a driving force for all the modern non-communicable diseases, starting with diabetes, hypertension, heart attacks, heart failure, fatty liver. Fact that the newer medications are not just controlling glucose. Independent of their effect on glucose, they are also protecting your organs. People worry, organs kharab to nahi ho jayenge type. Actually it's the reverse. Organs are getting damaged because of diabetes. They have multiple actions on our organs so that they actually benefit us in reducing complications regardless of their effect on blood sugar. That has been a quantum shift in diabetes management.
How do you prepare your team for rapid advances in endocrine therapeutics and diagnostics?
The human who is the endocrinologist, that is the key. So you have to hire the right people and you have to give them a free hand. And then you realize that with a contributory effort, the changes are happening much faster, much better, adoptions are quicker, and sometimes you're learning. So I firmly believe in investing in people.
So one test everyone over 30 should not skip.
If you're talking one laboratory test, I suppose an HbA1c. HbA1c, for those who don't know, is an average of the last 3 months of blood sugar. And it's a good test to monitor diabetes.
And sir, one piece of advice you will give to young adults.
In one line, if you're looking to fight, prevent, treat chronic disease, not to allow it to creep it onto you or to hit you, maintain your weight. The fact is, everyone was ideal body weight, right? We wouldn't have type 2 diabetes. Almost, we'd get rid of it. So that's the key.
Welcome to Bold Voices, organized by Voice of Healthcare and Polymed. Today we have with us Dr. Ambrish Mithal, one of the most renowned endocrinologists with pioneering work in diabetes, thyroid disorder, vitamin D, and osteoporosis. With 4 decades of clinical experience, research, and leadership, Dr. Mithal has played a transformative role in shaping endocrinology in India. He currently serves as Group Chairman in Head Endocrinology and Diabetes at Max Healthcare, a group of 22 hospitals. Over the years, he has held leadership positions at Medanta, Apollo Hospitals, and academic institutions like SGPGI Lucknow, contributing to medical education, policy, and public health. He is the recipient of numerous awards and honors, which include Padma Bhushan and B.C. Roy Award 2050, Laureates Award for International Excellence in Endocrinology 2021 by the Endocrinology Society US, IOF Committee of Scientific Advisors Medal of Achievements 2025. His book, The Weight Loss Revolution, which talks about new weight loss therapies, was published in 2025. Welcome, sir.
Thank you so much. Thank you for the kind words.
Sir, my first question to you is, what is the biggest change you have seen in how endocrinology diseases are treated today and earlier?
So I think, it's a long period. It's 40 years. So I have seen a lot of change. But when we joined endocrinology as a specialty, it wasn't that glamorous a specialty. All the glamour was in cardiology and those kind of fields. Right. And what we take for granted today, like diabetes is like household word, was considered just one of those diseases, and it was thought that you need to maintain blood glucose around 200 and that's good enough. Obesity wasn't a big problem. Diabetes prevalence was 2%, 3%, 4%. Those are the kind of data, Initially, gradually, and then exponentially, there has been a dramatic change in the pattern of disease in India. The pattern of disease in India at some level has become much more Western type of pattern, right, because of change in nutrition. But because of the rapid change, it is in many areas exceeded the prevalence in the West or any other country. So we never spoke of diabetes epidemic that time. We never spoke of the requirement for tight control of diabetes. We said, it's okay, manage around 200 blood sugar, it's okay. So that is in that area. That is one. Similarly for obesity. Similarly for many other endocrine conditions which can be linked to lifestyle. That was pretty common now, but it was not very common earlier.
Right.
But in terms of endocrine diagnosis and therapeutics, there's been a dramatic change also. One of the most major changes, again, something we take for granted now, is the use of hormone estimations. Hormone assays in the 80s in India were a big deal. It was hard to get a reliable hormone test. It took forever. When I was studying at AIMS, we used to do the tests ourselves.
Okay.
It was so sacred to do hormone testing and all, which patients now complain if they don't get the result in a few hours. So technology in hormone testing has been a huge shift. And the easy availability of that technology in India after the economic liberalization of the 90s has been dramatic. So that the gap between what we read and what we practice has narrowed to an extent that sometimes we are also now Indian endocrinologists are writing stuff that others read and follow.
Right.
So the wheel is turning.
Yeah.
So one is the hormone assays, and the other is also, again, I would say, with the advent of economically viable institutions, imaging techniques, all the latest radiology, latest nuclear medicine. So again, we're almost at par, or in some cases ahead of many institutions even in the West. So I think endocrinology has seen a great boom.
Yeah.
And the last in that, if I were to just flag the major things that have changed. So one, I said, lifestyle disorders increased dramatically.
Right.
Number two, I said, technology improved things a lot for us. And the gap between India and the West reduced a lot. And I would say another watershed moment is the discovery of these new GLP-1 molecules, which are, again, changing the way endocrinologists look at chronic disorders. So all these are if I were to, in a capsule, leaving out many, many important things, but three that stick out in my mind are these.
Great, sir. I think the diagnostics and the treatment modules, everything is changing, and we can make use of these. So how has the medical mindset around obesity changed over the years? Should we rethink obesity from willpower to chronic disease?
Endocrinologists have always been reading about obesity and discussing obesity. Way back in 1997, the WHO classified obesity as a disease. Okay, so it's not now. It's 1997.
1997.
Yes, so
I
now
think nobody knows.
Nobody knows that. So the thing is, why? So because the increase in lifestyle disorders in the West was already happening at that time, the understanding that obesity is a driving force for all the modern non-communicable diseases, starting with diabetes, hypertension, heart attacks, heart failure, fatty liver, and so many others. So many others. A long, long list of conditions, sleep apnea, neurological conditions, even some cancers. So all those we know have been linked to obesity. And a rise in these disorders is linked to the rise in obesity in the population. So it was then thought that obesity is important enough to be labeled as a condition or a disease on its own. And not just as a precursor to these conditions. So I think that is very important. Why was it not talked about? We knew, I'll give you an example. We knew that cholesterol is important for some time, but the interest in cholesterol only really perked up when statins were discovered.
Correct.
Now, for obesity, all these years, endocrinologists were terrified of obesity. because of two reasons. First, it's a cause for so many conditions. And then you have to keep repeating the same gyan again and again about diet and lifestyle. And in the first few visits, it works. And then there is people enter that cycle where they can't lose it anymore, or they lose it and put it back on, and they come to you with great hope. You're the endocrinologist, and all you answer is the same stuff again, which most of them know. So, we used to be, oh God, how do you, if your outpatient is full of just obesity, you wonder what to do. You get the nutritionist, you try everything, and it worked for some people beautifully. But there were lots where it didn't work as well. So it's quite frustrating, and you have nothing more to offer. You have nothing more to offer unless someone was severely obese, in which case you could go for a bariatric surgery or something. Why obesity has become center stage now, in the same way as statins made cholesterol center stage.
Right.
We suddenly have tools by which we can address obesity. That wasn't the case. So I think that is what has made a difference to bringing it really center stage. And now everyone's talking about obesity as a disease. And I have my reservations about that. I don't like calling anyone diseased for these kind of disorders. I even don't like to call people with diabetes as diseased or patients. They're individuals with diabetes or people with diabetes. So obesity is a disease means all the world is diseased, right? So I'd much rather, so that becomes a stigma. You see, if someone is feeling all right and has obesity, and you tell him you got a disease, you're sick. So that is a big emotional barrier, emotional load rather on the patient. So therefore, I prefer to call it a condition, but definitely a condition that requires attention, that requires focus, should not wait for the effects of obesity to appear. Please address it at the first instance.
Right. So I think it's a good takeaway that it's a precursor to many diseases, and I think it's a condition that has to be addressed. Okay, sir. So what old ways of thinking about diabetes do clinicians need to let go?
So I think most clinicians have understood the importance of diabetes. India has a very large number of diabetics, more than 10 crore. And doctors, through numerous education programs and interactions with each other, I don't think there are physicians in India who would not understand diabetes. There was a time maybe 30 years ago, but now certainly. So I think people are quite proactive in treating diabetes. The importance of good control has become understood. The importance of medication in achieving good control. What has changed, however, is the fact that the newer medications are not just controlling glucose. Independent of their effect on glucose, they're also protecting your organs.
Right.
People worry, organs kharab to nahi ho jayenge type. Actually it's the reverse. Organs are getting damaged because of diabetes.
Right.
So let me explain this further. The standards for control for diabetes were set way back in the late 90s. That also hasn't changed. All the WhatsApp forwards you get are all wrong. Nothing has changed in diabetes diagnosis in 25, 30 years. Okay.
Right.
So the idea was that if you control blood glucose well, if you control diabetes well, you're preventing complications. That was modified to if you control diabetes and blood pressure and cholesterol well, you are preventing complications. How you control it was not considered important till about 10 years ago, when drugs like SGLT2 inhibitors and GLP-1 drugs, they came into the market. What happened then? Now, these drugs, they not only reduce complications by controlling sugar, but they have independent beneficial actions on the organs.
Okay.
So that is a quantum jump.
Okay.
And that, of course, physicians are getting used to more and more now, that these drugs are not just anti-diabetic drugs. They have multiple actions on our organs so that they actually benefit us in reducing complications regardless of their effect on blood sugar control. So that's why that has been a quantum shift in diabetes management.
Right. And I think comorbidities. That is what we are discussing around diabetes. Please take obesity as a condition. Nothing has changed in diabetes diagnosis. This is what is being emphasized here, and we have to prevent the complications of diabetes. That is very important. So, sir, how can clinical leaders like you reduce stigma and misinformation around hormone disorders?
I think that is a big challenge, and it's very sort of culture specific, because different people look at things differently. Lifestyle disorders like diabetes and obesity in particular, that's visible. Diabetes is not visible often. Polycystic ovarian disease, all of them in our country, even thyroid disorders, I understand they carry some kind of stigma, especially when it comes to matrimonial relationships and all that, So I think it has been a consistent campaign for all endocrinologists, all sensible leading endocrinologists, to go on saying the right things about this. So I'll give you one extreme example. One of our biggest challenges is type 1 diabetes. Now, we all know the type 2 diabetes we're talking about. Type 1 diabetes is not a lifestyle diabetes. It affects young people, children, adolescents, sometimes adults also. It happens suddenly. And if you don't take insulin, then you're doomed, actually.
Yeah.
And if you do take insulin, everything is good. But there is such a stigma to diagnosing diabetes in an adolescent or a small child, where insulin is the only way.
Yeah.
So people do all kinds of crazy things and put their child at risk, and it's not unusual. And somebody will say, you go to this Baba, that Baba, they'll take away the insulin, and all kinds of things happen, and children land up in crisis in our care. I mean, that is heart-rending, actually, because there is a solution. It may not be an easy solution, but it's there. And in the absence of that, using that measure, the person is putting his life at risk. So those are the stigmata. I mean, for example, type 1 diabetes is a sensitive spot for most endocrinologists, because we try so hard with our children, girls and boys both, and yet, society, jobs, but that is changing.
Right.
Sustained effort is leading to a change in our acceptance of, say, type 1 diabetes, but not so much in obesity yet. In obesity, we still blame the individual. So sometimes that is right. Some people are just grossly careless, but it's not always right. And therefore, it's important that our mindset about obesity of all doctors, it is changing very fast, but also of public, is not to blame and shame. It doesn't help. It doesn't help. So very often, if there is a couple, the partner, the spouse will say that you haven't told her anything, she's so much overweight, or vice versa. Why didn't you tell her about her weight? It doesn't work like that. You have to take into account the sensitivities of the individual. You cannot always blame them. There may actually be a medical condition because of which they can't lose weight. So, and contrary to what people think, most obese people are actually a little depressed. We have this image of, fat and jolly people who you scratch the surface, and most of them are unhappy. Of course, they can't generalize, but most of them are definitely unhappy and often depressed. And you see how much better they feel after they've lost weight. So I think these stigmas have to go. It's working in both ways. With modern developments, the stigma is reducing because people are getting more aware, and they also are beginning to realize it's not always their fault. It's a condition that can be treated. But at the same time, the social media influencers, etc., who are portraying images which are often sort of AI edited images of perfect bodies and perfect physical strength and activity, that creates a lot of pressure because people spend more time on social media than they do in actual society.
Right.
So people really feel they can become like that person, So firstly, whether that person, how he did it or how she did it, and secondly, whether it's really like that or just created for the social media space. So there are challenges also.
Right.
So this is how it Sure.
Right. So I think we have discussed so many stigmas, and I believe that type 1 diabetes is one thing which needs attention, and that should be treated. And especially the children, I mean, the mindset of parents have to change and they have to be treated. So, sir, how do you prepare your team for rapid advances in endocrine therapeutics and diagnostics?
I think as far as the team is concerned, my firm belief is get the right people. This I have tried to follow since I was in teaching institution, a professor there, or whether I was in 3 major institutions of the country in private sector. You have to choose your people carefully. Endocrinology is all about the right person. Technology in endocrinology is provided mostly by support departments, by radiology, by pathology, outstanding technology. But the human, who is the endocrinologist, that is the key. So you have to hire the right people and you have to give them a free hand. Once people are so highly qualified, they've done the highest degree in the land, they don't want to be controlled. So you have to set examples as much as possible. And B, you have to give them a free hand. And then you realize that with a contributory effort, the changes are happening much faster, much better. Adoptions are quicker, and sometimes you're learning. So I firmly believe in investing in people. In our kind of field, choosing them. If you make one bad choice, the whole department whole system can get affected. So take your time, choose the right people who are well trained, whose attitude is good, and who are willing to work hard. I think automatically the excitement of newer things. No one wants to stay then in the, you want to be abreast or ahead of the curve. And that is what I keep driving. We have to be ahead of the curve and not just following the curve. That's never been a principle that we followed. So, and then get people excited enough. They have the capabilities anyway. They have the skills anyway. And things happen. So, again, to repeat, I really believe it's about choosing the right people and giving them enough freedom within a particular framework. But other than that, no one's watching over your shoulder. You can do what you like.
Yes. So lead by example. These are the leaders we are talking to. So it's time for some rapid fire questions. So, ultra processed food, how much is too much for every day?
Ultra processed food, I would say, in an ideal world should be 0.
Okay.
So minimize it. Anything coming out of a pack, the biscuits that we normally eat, all that, everything is ultra processed actually. So it's a big challenge. In India, all the namkeens and all which were homemade are also now, go through various processes to keep them forever. So all that is also ultra processed. So most of the snacks that we have, mindlessly, if you ask me, we all do that. I do that also. We're not thinking in a meeting, you just go on picking up things. Really, we should limit to as low as possible.
Okay, sir. Sugar-free products, are they really safe or are being misled?
So it's not a one-line answer. Sugar-free products are okay in general. It's not prohibited to use them. You can use them. The thing is, one shouldn't go overboard with them. So the challenge is that if someone has a sweet craving once in a while, has diabetes or whatever, especially in people with diabetes, you can use a sugar-free, one product, and you have to look at the other contents of that product. Sometimes just being sugar-free, we feel it is absolutely safe. So like if you buy sugar-free chocolate, I'll give you an example. That has 60% roughly of the calories that regular chocolate has.
Right.
So we need to be sure of what we are consuming. That is one part. About the sugar-free compounds themselves, they're okay, sweeteners, but maybe, 1 or 2 servings a day, used in the right way, totally to manage a craving is okay. There is no clear evidence that using them causes any harm, but there's a lot of circumstantial and other evidence that too much use can lead to many disorders, including metabolic disorders also.
Right.
So I guess the old adage that we were told when we were children, it's ingrained in the DNA actually, take the path of moderation in everything. And you'll usually be right.
Right.
Yeah.
So moderation is the key. So 1 meal a day, Smart strategy or metabolic mistake?
Ultimately, it depends on the individual. Now, everyone's metabolism is not the same. Number one. Number two, it depends on your health situation. So, like people ask about intermittent fasting a lot, maybe 2 meals, maybe even 1 meal a day.
Yeah.
So, for some people, it works okay. I have no problem with that. If they're able to handle it, if they are feeling comfortable with that, if that's how they can keep their calories in check, their weight in check, I'm okay. At least for 2 meals a day and spaced within 8 hours, it's quite acceptable.
Yeah.
But there are many who can't do that. People with complicated diabetes should not attempt that. Those who are on multiple drugs, etc.,
Yeah.
they're not candidates for those kind of things. People who already have a lot of acidity, GI problems, how can they go on prolonged fasts? So you have to be sensible. Please talk to your doctor. I suggest it is not a no-no, but it is only for selected people.
Right. So I think every body is different. Thin people can't have metabolic problems. True or false?
It's false, particularly when we are sitting in South Asia and India and talking about that, because Indians notoriously have metabolic problems even when they are thin. And an acronym I commonly use to explain to patients is TOFFEE, thin outside, fat inside. Because what happens is, although we look thin and we are not really fat or anything, but within our bodies, around our organs, fat collects. And that truly is the bad fat. That produces toxic substances, that produce inflammation, diabetes, blood pressure, all kinds of things. So thin people per se is not a guarantee that you are metabolically healthy. You might be getting metabolic derangements. Do your blood tests as advised by your doctor. If necessary, do a body composition analysis, not difficult anymore, to figure out how much visceral fat you have. And by body composition, there are many techniques and there are good techniques, but at least an acceptable technique is the bioimpedance machines that you see now outside every gym and every slimming center, where you just stand on that and they give you a breakup. So don't believe them completely. But they give you a fair idea of what.
Right. And so insulin means diabetes has become very serious. Is this true or false?
It's false. Okay. Insulin for type 1 diabetes means you have type 1 diabetes, you need insulin. For type 2 diabetes, insulin is used in many situations, not as a last stage, not as a last resort, or now I've lost the battle and now I have to start insulin. That's completely wrong. There can be many situations. There can be pregnancy, there can be infections, there can be hospitalizations, or just for better control, a person may require insulin even early in the course of disease. Certain kinds of type 2 diabetes also may require insulin earlier than others. So insulin is not addictive.
Right.
Insulin is not addictive. The biggest fear people have is that एक बार ले लिया तो हमेशा लेना पड़ेगा. And I don't want to start that. That's one thing. I've come to you for an answer and the person is taking 6 pills already and they say, but I won't take insulin. Before you can even say it, they will say, insulin नहीं लेना. I said, why? वो मेरे मामा ने कहा था या मेरे फलाने ने कहा था. बाकी कर लेना, but insulin मत लेना. What they associate is, in their family, people have started insulin very late. And by that time, the kidneys are already gone or liver is going. And they say that insulin caused all that. And if they had actually taken insulin earlier, it would have prevented all that.
Right.
So I think that is very important. It's not a failure. And it's not the last stage.
Right. So insulin is not addictive and it is required sometimes. So one test everyone over 30 should not skip.
If you're talking one laboratory test, I suppose an HbA1c, an annual HbA1c would be very helpful. Although I would add that you should probably be checking your lipids every couple of years, maybe your liver, fatty liver, so common, liver function test. But if I have just one, if I have to prioritize, in my mind, fasting glucose and an HbA1c would be most important.
Right, sir. And so
you know HbA1c, right?
Yes.
HbA1c, for those who don't know, is an average of the last 3 months of blood sugar. And it's a good test to monitor diabetes.
Right. And so one piece of advice you will give to young adults.
In one line, if you're looking to fight, prevent, treat chronic disease, not to allow it to creep it onto you or to hit you, maintain your weight. Now, there is a whole list of things of how you do that. If you can maintain your body weight, the chances of your going onto that track are very limited. You're helping yourself a lot. Now, to go on to maintain your body weight, you will need the correct diet, you will need exercise, you will sometimes even need medication. But the fact is that if everyone was ideal body weight, right, we wouldn't have type 2 diabetes. Almost we'd get rid of it. So that's the key.
Right. And so one change you want to see in endocrine practice in next 5 years?
I think less and less stigma and more prevention. I think prevention is the key, at least in our time, even more in our time. Doctors are trained to treat disease. The sick patient, go to the doctor, get treatment. We are the doctor. We are trained in this. We're going to fix you. We have to move leftward. The curve has to move left, which means we have to, as doctors, focus more and more on prevention of disease. And that's the change in approach that is happening. And I would like it to be really fast. And every doctor, not just an endocrinologist, should be looking at disease prevention along with disease treatment when it happens.
Right. So on that note, prevention is the key. Thank you, sir, for joining us today. Thank you.